It is my great pleasure to welcome to our program today our speakers representing the Armenian American Health Professional Organization, Dr. Lawrence Najarian, Dr. Deborah Furman, and Dr. Joyce Kurdian. They will talk about AAHPO's activities in Armenia, Artsakh, and the Armenian communities in the tri-state area. Dr. Lawrence Najarian is a second-generation Armenian American and the founder and the medical director of a Bedminster Eye and Laser Center in New Jersey. A board-certified ophthalmologist, he has been in practice for nearly 30 years. He is a graduate of the Johns Hopkins University, University of Pennsylvania Medical School. He completed his residency in ophthalmology in NYU Bellevue Medical Center. For over 30 years, he has served as voluntary faculty teaching ophthalmology residents at NYU. Dr. Najarian has served as president of the Armenian American Health Professional Organization, AAHPO, since 2006. Dr. Najarian also served on the board of the Armenian Eye Care Project, which honored him with a Silver Award for his service to Armenia. Through these organizations, he has led and participated in multiple medical missions to Armenia, facilitated the donation of a $1 million microsurgical training laboratory, helped provide training to physicians in rural villages, and raised funding for telehealth programming. Dr. Najarian is a recipient of the Ellis Island Medal of Honor. In addition, he received the Healer of the Year Award for the Teaneck Chamber of Commerce. Please join me in welcoming Dr. Lawrence Najarian.
Thank you, Ara, for that wonderful introduction.
Thank you.
It's so nice to meet an old friend. Ara and I first met in 1994, and due to the vibrancy of the Armenian community, I had the opportunity to meet and serve with his two brothers, and then reuniting with Ara for today's program. So thank you very much, Ara. Thank you to everybody from upstate New York. It's really a pleasure to meet with you. And this is a hard act to follow. The children were absolutely amazing. And I think there's one comment about this is the first generation who grew up virtually. So again, thank you so much. It's also an honor to be with you in remembrance of St. Vartanantz Day. This is a day commemorating the sacrifice and the unified determination of the Armenian people to help preserve our freedom of religion, something that we strive for to this day. I have the privilege of serving as president of the Armenian American Health Professionals Organization, and a pleasure being here today with both Dr. Debbie Furman and Dr. Joyce Kurdian, who I'll introduce a little later on in the program. A little bit about us. We were founded in 1994. We're a multifaceted, volunteer-led 501c3 medical philanthropy. We represent over 500 healthcare providers in the New York, New Jersey, and Connecticut area. And it's our belief that we have a lot to offer the community if we can harness our energies and work together in a united fashion with the correct platform. Together, we look for innovative healthcare solutions. And what we do is we provide healthcare services and education. We do medical mentoring. So for our youth that are interested in careers in the health professions, we get together with them and bring them along. We have medical workshops in the churches, and we can do this virtually now anywhere. So we're more than welcome to come up to your areas and discuss issues, medical issues with your parishioners. We have done emergency medical consultations and counseling for our brethren in the tri-state area. We want to thank our donors, our volunteers who give so much of their energy, their money, their time to bring a range of healthcare and much needed medical supplies to both here and in Armenia. Much of what we do comes from our 34-word mission statement. Mission statements are so important, and it's this mission statement that we read at every board meeting when we think of our programs, how we're going to implement those programs, and of course, do they fit into our mission. If you do have questions, you can always contact us at info@aapo.org, where you can also email your questions as well as put them in today's chat and write them down for discussion later. I think what makes our organization so unique was a very novel idea for 1990. Before 1990, there were medical doctors who stood together, there were dentists who stood together, there were pharmacists who stood together, and nurses who stood together, but they were all in different silos. Our organization brings all of these fields under one roof, and that's what makes us so special, because we get to see multiple different points of view and hear out ideas before they're actually implemented. We're going to talk a lot about what we do in Armenia, but I think we want to take a moment to discuss the value we help bring to our community during this COVID-19 crisis. We're very, very fortunate to have a very astute board who saw in early February the warning signs, February of last year. It's hard to believe we're in this for a year. And beginning on March 14th, we started the first in almost a weekly series of email blasts going out to our community. These are email blasts that you can sign up for. There's no charge to anyone. The churches can use them. We can design them for your groups, but they're very informative, addressing the questions that people have about the coronavirus. These blasts were also translated into Western Armenian by our brethren over there and distributed to the Armenian communities living in Armenia. We also held 4 webinars open to the public, including one that received over 10,000 views. We also right now are in the middle of a campaign addressing the mythologies around the vaccine. And again, if any of you have any questions about the vaccine, just remember that every day, 3,000 to 4,000 Americans are dying from COVID-19. Very few people die after they've had a vaccine. So please, if you have any hesitancy about getting a vaccine, discuss it with your physician or contact us. We've also believed that knowledge is power, that as we've gone along, we went from this mysterious COVID-19 to where we are now with a body of research, evidence-based research and literature. And we now share that and have been sharing our knowledge since the very beginning with the clergy, with the leaders of our nonprofit communities, so that they in turn could make the best decisions that we all could follow. I particularly want to give a big shout out to 3 people who are panelists at our AAHPO town halls. They've been vital to our robust response to the COVID-19 pandemic. Dr. Celine Kojaglanyan, who's both an infectious disease and pediatric specialist, who sits on several planning committees for New York State and New York City, an associate professor of pediatrics. Dr. John Bilazikian of Columbia University, who started the Osteoporosis Treatment Project, who has shared with us his wisdom regarding the coronavirus as this pandemic has progressed. And Dr. Kim Akimian, who is really an all-star in public health, sits on our board. All 3 are board members. Dr. Akimian started the School of Public Health, part of American University of Armenia. It's the program that several of the current ministers of health in Armenia have graduated from. She has put together an advisory board that meets every week and has been providing evidence-based medicine and advice regarding public health matters to the Republic of Armenia since this pandemic began. It's with a big debt of gratitude that I want to thank each of these 3 physicians. Where did philanthropy in Armenia begin? It was really born of crisis where we are again today. It was the crisis of independence. It was the crisis of war with Azerbaijan, the crisis of an earthquake. And that's when we began to hear the siren song to help Armenia to progress to where we are today. We owe a big gratitude also to Dr. Edgar Hausetian. He was not very involved in Armenia. He was the chairman of neurosurgery at Columbia University. But when crisis hit Armenia with the earthquake, he organized the first medical mission and aid to Armenia. He recruited Archbishop Toko Manukian of the Eastern Diocese and Kevro Kovnanian to formulate a short-term response and a long-term response, which we know today as Fund for Armenian Relief. So we really want to thank him for all of his energies and all of his foresight in establishing where we are today. We're not the only organization helping Armenia, and I really want to thank all the organizations, including the Knights of Vartan, which is not on this list, but clearly our community has a lot to offer, and together we can achieve more. One of our largest projects, we've been active since 2011, is in sharing information. We're not really into the process of donating material goods and buildings, but we want to share our knowledge. We've been collaborating with Fund for Armenian Relief since 2011 and spent close to $250,000. Our goal has been to provide the latest evidence-based medicine to the physicians of Artsakh. And in that goal, prior to the current events, we provided training to over 80% of the physicians in Artsakh. What we've done is, well, just backing up for a second, our belief is that if we could teach a physician some of the latest technologies, they in turn could have a cascading effect on thousands and thousands of citizens of Artsakh. So we identify physicians that have needs. It might be a primary care doctor that doesn't know how to treat asthma in children. It might be a cardiologist who needs the latest information on how to treat a heart attack. It might be a surgeon who needs to know how to deliver a baby by C-section. What we do is we then, after having identified them, we bring them to Armenia where we provide housing. They live there for a month. We give them a stipend so they can provide for their families back home. And we match them with a specialist or a trainer who was trained in the United States in the 1990s by a program Dr. Edgar Housepian set up. In addition to giving them the latest evidence-based medicine, we also give them computer literacy. Many of these physicians didn't know how to use a computer. They're isolated in rural villages. But once you give them the computer, literally the whole world is at their hands. Everything opens up. They can now do research on their own. They can now connect with the diaspora, with physicians in Armenia via Skype, and again, share their interesting cases, learn how to proceed in treating complicated situations. We also started having meetings in Artsakh prior to the war. Now the program is changing due to events on the ground. We're now bringing the trainers to Artsakh, as many of these physicians have to, are overworked and can't leave their homes to go to Armenia. So we're coming to them and giving them more information so they can help their brethren there. We're also very mindful that there are physician refugees, and we're exploring ways to bring these physicians back to their homes. Our belief is that we can provide a situation where the communities have healthcare, that many refugees will return to their homes in Artsakh. Now, Artsakh is far away, and AAHPO was very fortunate to have pioneered telemedicine or high-bridge telehealth all the way back in 2008 due to the efforts of Dr. Kevork Yalcin. We have been conducting since 2008 meetings, conferences, consultations on a monthly basis with our colleagues both in Armenia as well in Artsakh. It's proven to be very, very efficient. And as we found out recently with this pandemic, telemedicine is here to stay. We're currently looking at ways to expand this program. We also have a visiting professorship program. You know, we all want to do good. And the biggest mistake I think a lot of healthcare providers make is they go to Armenia, they show up and they say, now I want to help. But I think planning is very important to maximize their experience and maximize the experience of the physicians and healthcare providers there. So we do have a network of hospitals that we work with. And just like we match our Artsakh physicians with special trainers or mentors in Yerevan, we match our volunteers with the hospitals they can go to so they can maximize their abilities and maximize their impact while they're there, whether they're English speaking or not. I want to give a big shout out to these two physicians. Dr. Ozvath actually went to Artsakh and lived in the hospital emergency room for a month, where he provided 7/24 assistance and teaching while he was there. Our medical mission program is also a very interesting program. We've had medical students join us, people who are interested in going into the medical fields, wanting to go. But we're going to hear so much about this from Dr. Joyce Kurdian in a moment. I think the medical missions program, though, one of its biggest values is we get to break bread with our colleagues. We work with them side by side. We go out for dinner with them in the evening. We take walks with them. We get to know them and they get to know us. A bond develops. And through this and through our telehealth programs and through the CME program, we find that this is the ultimate in the relationship where you develop, you have this relationship where it's very open and people can consult with you on a daily basis if needed when they have those challenging cases. So that's a little bit about our organization. I want to really express gratitude to our donors. I also want to thank all of the organizations in the Armenian community that are listed here and others for all of their support. We do best when our information, our medical messages get out into the community, and it would not get out into the community without all of their support. We're here to support the community, and we very much appreciate all of their assistance during this pandemic in particular. So a little bit about COVID. We will overcome this together. We're in a much, much better position today than we were last February when we were just waking up to the reality of COVID. We have a vaccine. We have treatments, which are amazing. Given a year ago, we had none of this. There is light at the end of the tunnel, but I have to tell you that the measures of wearing the mask, wearing goggles to protect our eyes, and social distancing are still an essential part of our prevention. So even though things are getting better, we still must comply with all of these measures. I can tell you that I personally, as a physician, is amazed at how effective these measures are. I've been exposed to patients who a day or two later found out they had COVID. I've seen thousands of patients since this pandemic began. And I was pleasantly surprised several weeks ago when my antibody test came back negative, which means I never had COVID. So what that tells us is a reassuring message that the mask, the goggles, the social distancing work. It's not perfect, but it works. So again, I encourage all of you to do that.